Hi, my name is Jennifer Ramirez, and I am going to be talking with you all about care coordination and relation to patient-centered care. So this is for NHS 4050, Coordinating Patient-Centered Care. In this presentation, we'll review multiple topics that relate to the care coordination of patients and how the nurse plays a vital role in this process. To begin, care coordination can be defined as the deliberate organization of patient care activities between two or more participants, including the patient, involved in the patient's care to facilitate the appropriate delivery of healthcare services. Organizing care involves the marshaling of personnel and other resources needed to carry out all required patient care activities, and is often managed by the exchange of information among participants responsible for different aspects of care. Gorin et al. 2017. This is a rather long definition of care coordination. The length of the definition gives some insight into what is entailed in the process of care coordination. Care coordination is the #1 strategy for collaborating with patients and their families to achieve desired health outcomes. From the quote mentioned before, the care coordination will include the organization of patient care, the patient, another person involved in patient care, and other participants required for different aspects of the care. From this list alone, there are going to be many people involved, including multiple disciplines, to manage a patient's care. With all of these different people involved in providing care to the patient who is going to coordinate the care. This is where nurses come in. The nurse is the key player in coordinating patient care, and the following presentation will analyze different components that support this claim and show improved healthcare outcomes for the patient. We will continue by looking at examples of when there is a lack of care coordination and how it affects aspects of patient care. Lack of coordination leads to care that is fragmented, inconsistent, and poorly planned. Medical errors, duplications of tests, and paper shuffling can occur, with results ranging from inconvenient to life-threatening. Swan et al. 2019. For example, if a nurse is not able to provide care for a patient that is planned out and consistent, there can be mistakes that are made. In my own experience, there was a nurse that was observed to be fragmented and inconsistent with patient care. The nurse was visibly disorganized in how care was done for the patient. The nurse would have no order to what was being done with the nursing daily tasks, like checking in with the patients, providing medications at correct times, assessing patients, charting, or documentation. The nurse ended up giving the incorrect medication to the incorrect patient, and this was a med error. This specific example could have been detrimental to the patient if the patient that was receiving the medication was allergic to that med. The nurse ended up getting lucky in that case. This was a potentially life-threatening accident. Later that day, the nurse ended up drawing blood from a patient that did not need blood drawn. This was another issue and was very inconvenient to the patients and the nurse, creating more work for the nurse since they now had to do damage control for the patient who received unnecessary lab work, also creating more work for drawing the labs on the correct patient and increasing documentation. Now, we will analyze how healthcare organizations can be affected by a lack of coordinated care can also lead to unnecessary emergency room visits and hospitalizations, avoidable readmissions, and excessive resources being used, causing billions of dollars in wasteful spending each year. Researchers estimate that $25 to $45 billion is spent on avoidable complications and unnecessary hospital readmissions. Swan et al. 2019. This example shows that a lack of care coordination can lead to many services and treatments that can create billions of dollars of unnecessary services. Implementing a care coordination component in the nurse's scope of practice could decrease this unnecessary spending for the healthcare agency. With this amount of money that is being saved, there could be many improvements to the healthcare agency. For example, increasing wages for employees, bonuses, better employee benefits, expanding technology for the agency as a whole, and many other areas that the money could be utilized to improve the quality of care in the healthcare organization. With care coordination saving $25 to $45 billion available to use for improvements in the healthcare, this could go a long way to improving patient outcomes for the better. As discussed before, registered nurses are going to be the leaders in the care coordination implementation for healthcare agencies. RNs lead care coordination programs and interprofessional teams across diverse acute, post-acute, and community-based settings, playing pivotal roles in the design and implementation of new care delivery models such as behavioral and physical health integration, patient-centered medical homes, accountable care organizations, and emerging payer-based care delivery initiatives. Swan et al. 2019. For this example, it can be concluded that the RN's initiate the leading care coordination among multidisciplinary teams across the disciplines. The nurse is responsible for the entire continuum of care for the patient, as evidenced by this example. The nurse provides the continuity of care from the bedside into the community. The reach of the nurse's influence in care coordination is far. This is why nurses are the pillars for successful outcomes of the patients. In the following segment of this presentation, we will discuss the aspects of change management that directly affect elements of the patient experience that is essential to the provision of high-quality patient-centered care. We will focus on aspects of care that are highly valued by patients and distinguish between what patient experience and patient satisfaction is. Engagement in self-care management and shared decision-making values the strengths and contributions individuals and families bring as members of the healthcare team and underscores a shift away from more paternalistic models of care in which clinicians tell individuals what they should do, to models in which providers partner with individuals. Swan et al. 2019. This particular style of care coordination is addressing each component of change management for care coordination. Instead of telling the patient what they should do, the patient and entire care team are directly involved in the care coordination. This gives the patient and the caregivers autonomy over the care of the patient. It also allows for high-quality patient-centered care. It provides a sense of power for the patient and being able to make decisions about the care that is being done and the care plan that is being coordinated for the patient. With this new approach to care coordination for the patient, they would have a sense of value and feeling of involvement in their care. Allowing the patient to engage in self-care management allows healthcare providers to tailor the care coordination to the patient to make it work for them. This allows for better patient outcomes, and the overall experience of the patient will be better with improved satisfaction for the patient. Not only will engaging in self-care management improve the patient experience and satisfaction, but it will also improve health outcomes, decreasing unnecessary financial spending for both patients and healthcare organizations. Strengthening self-care management and shared decision-making supports improved health outcomes and care experiences, as well as contributes to managing costs. Swan et al. 2019. Managing costs is a big concern for both the patient and the healthcare agency. With improved self-care management, this could minimize the costs for any type of issue that could have been managed with improved self-care. Patients are and should be encouraged to utilize self-care management before discharging from the healthcare agency to evaluate the self-care management and prevent any readmission. This will improve self-efficacy, empowerment, adherence to treatment regimens, and quality of life. Swan et al. 2019. This will help the patient minimize costs and co-pays, medical supplies, transportation fees, and time. This will also help the healthcare agency from having to retreat already treated cases and decrease the costs that could have been avoided with patient self-care management in the care coordination plan before discharge. This is why the coordination of care needs to encourage patient autonomy and self-care management from admission to discharge and in the community. This method will increase patient-centered care and provide higher quality of patient care while improving patient outcomes. In the following discussion, we will look at the rationale for coordinated care plans based on ethical decision-making. We will also identify the logical implications and consequences of an ethical approach to care and articulate underlying assumptions that guide decision-making. For example, cancer care coordination approaches led to improvements in 81% of outcomes, including screening, measures of patients' experience with care, and quality of end-of-life care, Gorin et al. 2017. This example suggests that care coordination is one of the decisions that has been made to help improve patient outcomes by 81%. Implementing the care coordination approach to cancer patients is not a hard adjustment to make to improve the quality of the patient's life. The quality of patient care towards end of life is something that has to be addressed for the care coordination in cancer patients. As nurses, we are morally and ethically bound to provide the best care for our patients and have an obligation to make the patient as comfortable as possible during this time of a patient's life. It is unethical to assume that just because a patient is dying, they do not need the same care as any other patient. It is unethical to deny the appropriate care coordination for a patient just because they are at the end of their lives. As the example mentions, the care coordination of cancer patients has guided ethical, logical decision-making that has led to improvements in various aspects of patient outcomes with cancer. In this section, we will discuss how a newly defined term guides nurses in making ethical decisions for the patient care coordination. A study was done from the Journal of Nursing Ethics titled Concept Analysis of Moral Courage in Nursing, a Hybrid Model, which analyzed 3 phases: theoretical phase, field work, and final analysis phase, that apply to the rationale of nursing ethical decision-making. What was found is that one of the most fundamental virtues in the nursing profession is moral courage. This is the foundation of professional excellencies resulting from moral courage. Nurses can provide this concept in professional care, creating peace of mind, decision-making, and proper functioning. With this new concept that has been analyzed from the example shown here, we have to look at how this is shaping the care coordination of the patient. This example supports nurses being the pillar of care coordination of a patient. They are at the underlying driving force behind ethical decisions fueled by moral courage. The nurse is also the patient's advocate, and they are the ones who are going to push for the patient's best interests and best outcomes, which guides them to make ethical decisions. With this new idea of moral courage being one of the main roots supporting the nursing profession, it could be concluded that nurses are and should be the leaders in the care coordination team for the patient. Next, we will identify the potential impact of specific healthcare policy provisions on outcomes in patient experience. In the journal, Translative Behavioral Medicine, an article titled Aligning Implementation Technology and Policy Strategies, it discusses care coordination for chronic conditions like cancer. For example, the chronic or collaborative care model is applied to promote proactive care management, self-management support, and community resource linkages in the context of enhanced information system-based communication. This model, applied to patients with chronic diseases, has shown better outcomes according to the article. This model was implemented by the Veterans Affairs in the patient-centered medical home model. This policy and provision has been shown to improve patient outcomes. The main point of this implementation is that when a healthcare policy is implemented based on strong evidence-based support, the goal is that the